Welcome back to Morning at NTV, the number one breakfast show in the country that is big on first-hand information. The coronavirus pandemic is still rearing its very ugly head unabated. Yes, Morning at NTV has noticed an uptick. 179 million and some 932,000 plus cases of COVID-19 have been registered on the international scene. 179.9 million. Soon we shall be hitting the 180 million mark. The US is taking the biggest chunk of those cases with over 33.6 million. You have India in second position with 30.1 million, and in third position you do have Brazil at 18.2 million plus cases of COVID-19. How many vaccinations have we undertaken on the 7.6 billion people who roam this earth? We do know that some 2 billion and 789 million 865,000 plus vaccinations have been undertaken, meaning out of the 7.6 billion people who roam this earth, 10% have received all their dosages. All those 2 dosages of the vaccines on the global market have been received by 10% of the 7.6 billion people. And we do know that 22% of those 7.6 billion people have received at least 1 dosage of either Pfizer-BioNTech, Moderna, Johnson & Johnson, or AstraZeneca, or any of the vaccines on the market that have been approved by the World Health Organization. The situation is debilitating. People are dying. 3.8 million on the global stage have lost their lives. Here in Uganda, the situation is different, but the deaths are rising. 781 people have actually died. Yes. So we do have Harriet Nakacha, a public health practitioner working with Angel Medical Care, and we would like to know what is being done, what efforts are being done by the private medical facilities in this fight against this COVID-19 pandemic. What could be done? Do they have the capacity to handle the mammoth crowds of people who are bombarding centers, health centers to seek for help? Yes, we have 997 who are grappling for their lives in the health centers, but how many are within our communities? Over 22,000. Welcome. A very good morning, Harriet Nakacha.
Morning, sir.
So talk to us about the COVID-19 situation from your own perspective. What do you think is happening here? Paint for us a picture.
Thank you, viewers. I'm Harriet Nakacha from Angel Medical Care, which is located at Nakulavye, the former Delta petrol station. Nowadays it's called Corbel petrol station.
Corbel.
Yeah, Corbel petrol station around in Nakulavye. Yeah. So with the medical aspect, I think we are trying. We are trying. Though people are still dying, people, please, don't joke with COVID. It kills. It's real. Don't joke with COVID. It's real. So we have to do all the preventive measures like following the SOPs. You have to wash your hands, sanitize, put on your masks. Please stop overcrowding in the town or elsewhere in the other trading centers. Yeah, let's try to keep ourselves live and safe.
So the disease is in our communities. Tell us about how dire the situation is. Talk to us about how dire the situation is, the community prevalence of these COVID-19 cases.
Yeah, the cases were rising. The cases have been rising. And then we have to follow all the SOPs, please. Let's try to control by the guidelines from the Ministry of Health. Let's try to at least keep ourselves inside the house, as the president said. Keep home, keep safe. Please don't joke. COVID kills. It's not like a political thing as people joke with it. We have to follow. It's a virus, it kills.
Because in Kasese, I had a friend of mine, she was calling me yesterday and she was saying on a weekly basis, every day they record at least 10 to 20 people dying as a result of COVID-19.
So I think what you can
What
do,
about in your area of Nankulabi? How is the situation there?
the situation almost, we are trying to control, but then as people, they just joke with it, please, at times. Like a market, if you're entering a market, please try to wash the hands, try not to overcrowd, try to keep the distancing, please. It's so important.
How many of these COVID-19 patients or people clamoring for help or medical help come to Angel Medical Care Center?
Yeah, at
on
least
a daily basis?
on a daily basis, we have less than 30 or 50 per day.
Complaining about COVID-19?
Yes, please.
Go ahead.
Yeah. So we try always to give help. We have enough facility. We have enough capacity, please. Even we have an ambulance, for your information, which is nearby, and the others are just within the other located areas. So try at least to get the first treatment or the first control, because if it gets under your throat, people, you will die for nothing. Let's try to keep ourselves inside the houses. Let's follow the SOPs. I think by there, we can just get a good trial for this COVID virus.
All right. How has the private sector participated in this COVID-19 fight? We would like to know.
Yeah. I think, come again?
How has the private sector, participated in this fight against the COVID-19 pandemic?
Yeah, we've tried our best, like vaccinating if it's possible. Let people get vaccinated. Those who are just being tortured, it was just, I think, a mild symptom or whatever. Try to get also the second dose, just follow. People were fearing that after the first dose, those are just some symptoms or signs. We can treat them. And then, secondly, let's try to do the, whatever.
Yes, Harriet.
Yeah, at least let's try also the natural remedies, like taking hot tea once in a while, like in 4 hours. Let's take lemon in the hot water. Let's take the ginger. Let's take the exercising. It generates the cells.
The workouts, yes.
Yeah, it generates the
it boosts immunity.
It can boost the immunity. Yeah.
All right, go ahead.
Yeah, it can boost the immunity. Let's try to, because even it helps in breathing, respiration. Once you exercise well, everything will be fine.
Indeed.
Yeah, I do think so. So then we can also, if you are vaccinated, you can't get so tortured like somebody who is not vaccinated.
But you can still contract the virus.
Yeah, you can still contract it, because if you don't follow the measures, really you can have it. You have to put on your mask again after vaccination. You have to do other SOPs. You have to follow also the ministry guidelines. I emphasize on that.
So what advice do you have for members of the public who live in small spaces, people in like Katanga, slum areas? We are like 20 people in the same room. How are we going to ensure social distancing? In a nutshell, what kind of advice would you give to that particular group of people who live in crowded slums?
Yeah, I could advise, let's try to control actually. Once you are from somewhere, just wash the hands, sanitize. Then you can also remove your clothes which you have been moving with. Then you continue with the other people inside the house.
Because the virus particles could have clanged onto the clothes.
Yeah, the surfaces.
So the first thing you do when you enter the house, remove your clothes, take a shower.
I think that would be the best advice.
I see, go ahead.
But although you are many, okay, some places like Katanga, it's really something which is not easy. But then let's try to control. Don't just go somewhere, you are visiting everywhere, then you will make Katanga also overcrowded, please. Let's stay in our homes. Like in Katanga, if it's a small room 10 by 10, why do people keep there like 8 or 10? That are you really the same relatives or whatever? Let's try to keep away. Let's stay there like 3 or 4
they are.
For a while.
You'll be surprised, Harriet. They will be the same relatives, same mother, same father, like 8 to 10 people.
Let's try to keep.
Go to Chibuli, go to Katanga, and any of these slums. I'm telling you, it's a reality for so many of our people. That's why we were saying it might be so hard for our people in the ghettos to actually exercise the SOPs, because nature is actually part of this problem, poverty.
Yeah, poverty is there, but let's try to control.
And another thing, Harriet, the people within Katanga live near a national hospital, National Referral Hospital Mulago. But when we did talk to them why they do not go there for services, they clamored and said it is too expensive. Since it's a National Referral Hospital, it is too expensive, and they can't actually go there to receive any help. So we were wondering, because when we looked at the private healthcare facilities, you were also profiting from this pandemic. You were increasing prices. Oxygen tanks are going for 800,000 Uganda shillings, 1.6 million if you need 2 oxygen tanks. Help us understand what is happening here. Instead of helping government in this fight of COVID-19, it seems like the private sector is profiting from the pandemic, milking anything they can from the citizens of this country who are desperate for help.
Oh yeah. So as it is a pandemic, we are trying also to control some costs really. But then, though Katanga is near a National Referral Hospital, I think what chases them away, they just think that if you go there, they will kill you. But it's not real killing, please. It's not real killing. It's the COVID virus killing. Yes. It's not the people to kill. So let's try to keep in touch. If you fell in the National Referral Hospital, which is near, you come to Angel. We are just there.
The thing is, Angel is too expensive. Talk about that issue. The private healthcare facilities are profiting from this pandemic. Talk to us about that.
Well,
is it true that they are raising and charging exorbitant fees to desperate citizens?
Not really, not really. We are trying to control. So at least you talk to somebody, try to get some costs deducted. Yeah?
Okay.
They can, yeah, at least if you are like 4 people or 5, why not a deduction to such people? We have to help the community also because this is a real crisis actually in our country.
All right, let's take it by a case by case. Let's look at a case by case scenario at how you contract the COVID-19 disease and what you do after contracting the disease. Members of the public are watching, Harriet. So what are those negligent actions that you could expedite and find yourself acquiring COVID-19?
Yeah, actually, when you are contracted with this disease, please, for my information, let's just follow the SOPs.
What will lead to the contraction? What will lead to the contraction?
What will lead to the contraction?
Yes.
That is, at times,
how do you get infected?
You get infected due to the surfaces touching the surfaces. You can get it from the community where you live. You can get it from, like, you can get it from the way of transporting yourself. You can have somebody near you. There is an alert. Some people get contaminated, like by getting to the quarantine areas. They follow that. This is my relative. What they follow that. Then the others can get contracted, like really the way we breathe. Some people say that when I put on a mask, I feel bad, so I shouldn't put that mask for so long. But really, if you are near 4 people or 3, what do you expect? You are breathing the same air. You are taking in the same air. And
since it's an airborne disease.
And it's an airborne disease.
Yes, the particles are in the atmosphere.
Mostly.
Go ahead.
Yeah.
Go ahead.
So it's an airborne disease. Don't just joke with it. Anytime you can get contaminated through the air, through the touching. And even these kids who are from school, please. Kids, they have to play. They love to join hands together. They have to share. So let's try to control and teach them more techniques, I think.
Is it true that this strain of COVID-19 also affects children, like we are hearing?
Yeah, it depends on the immunity. Because those kids really have low immunity, like the old people we are. You also get low immunity. That's where you can get it. So some don't get it, but others get it. That's what I can say. Yeah.
So what can the children do to protect themselves? Stay away from the other neighbors' children. Number 1.
They like to play football and whatever. But let's try to control. Let's try to control. Please, with the kids, let's teach them. Wash your hands, sanitize. Don't greet each other by sharing or hugging. Let's try to control them. Also, they learn. They learn. And they see people dying, by the way. So they have to learn. You tell them, if you do this, the virus will
I believe the biggest problem here, Harriet Nakacha, is behavioral change. Our citizens have refused to actually adhere to the standard operating procedures. Not refusing, but government has done little to give them reasons as to why they should be obedient to the same. Do you think behavioral change can be achieved through force, like we are seeing, the use of soldiers and policemen? Why are medical workers like yourself not on the ground, assuring people that when you wear a face mask, this is what will happen. When you don't wear a face mask, this is what will happen. Do you think the way we are approaching this is all wrong? And that's why cases are rising exponentially?
What I could say, this thing is not a militant group to continue beating people doing what. I don't think you learn by beating. There are so many other things you can do and you learn. Let them teach them what to do. Really, if you beat somebody, even he will not know. If it's just somebody who is ignorant, he will not know. Some people still have that rigidity that, when you do this, you get it. So why do they beat us or whatever? Let's try not to relax. The thing is real, it kills. It's not political, that as you think that policemen are rough or what. Also they try, but except that their way of telling people or showing people is at times rude. At times, not all times, but at times it's rude.
Indeed.
Yeah.
Let's talk about the vaccinations. Are you undertaking any vaccinations at Angel Medical Facility?
That one, we left it for some other people, please.
Yeah. So you're not doing vaccinations?
No,
but are you doing any testing for COVID-19?
We do the COVID-19 testing.
How much?
It depends on the way you come, because you have to treat the signs and symptoms. Yeah.
Indeed.
Yeah.
So if you have aggressive signs and symptoms,
No,
you're going to charge me more.
No, we are not really charging more, but we try to compare at least. We are fair to other private sectors.
Okay,
we
give
are
us
just
an
fair.
estimate. Give us an estimate so that the person who is at home and wants to come to Nankolabi knows I should go with 200,000 or 300K.
Yeah, if it's like a PCR test for the COVID-19 testing, that is like 200,000.
All right.
Like for these people who go for, like we can have that one like for schools,
Yeah.
like business people, like the whatever, travelers. They need to travel. The airport is still working.
Yes.
Yeah, that one.
So
private individuals, corporate individuals, companies like that.
How long does it take for this COVID-19 results to come out?
It depends on what type of test you've done for the COVID-19 testing. So if it's like a PCR,
Yes.
that one is like 8 to 12 hours normally. If it's just like express, that is like 6 hours. That one you have to pay an extra cost, please.
Indeed.
We have to do the needful.
All right. If you are exhibiting
And
any signs and symptoms, please rush over to Nankolabi and talk to Angel Medical Care Facility. They'll actually give you some kind of help. When it comes to testing for COVID-19 and so forth, they are not doing vaccinations at all. So talk to us about the other issue, Harriet Nakacha. We had young people during the onset of the first pandemic who were saying, my immunity is way up there and I can't even acquire COVID-19. So they gave up on the face masks, simply saying that they were immune to the COVID-19 disease. But what we've seen with this new strain, it's even affecting the younger ones. People as young as 18 and 19 are contracting COVID-19, and some of them are even succumbing. Please talk to the public about that. The fact that your age cannot stop the COVID-19 pandemic from actually wrecking your body and your family.
Yeah, what I could talk to the young age, please, it can also kill. This second wave has been so serious, more than the first one, because people were just reluctant, most of them. People were reluctant. Then, next to that, these young ones, really, some of them are big-headed. That's what I can say from the behavior, whatever, their cultures or what. Let's try to control, please. Though you are young, though you are old, let's try to keep all the Minister of Health guidelines, please.
Harriet Nakacha, a public health practitioner from Angel Medical Care Facility, a private health facility in Nankolabi. Please go there and visit them and get some kind of help. But they are not doing vaccinations at any time. We also do have Ivan Olanyolo, who is coming to us with an update. Yes, he's talking to Sheila Nduochire, the spokesperson of the National Medical Stores. A very good morning, my brother. What's happening within that particular jurisdiction that you're hailing from right now?
Medical stores in NTV that took task as soon as the Ministry of Health received the AstraZeneca vaccine to start the distribution process. It has been ongoing to the different far ends of the country up to this time. But well, with me is the Principal Public Relations Officer for National Medical Stores, Sheila Nduochire, to just give us an update. And Sheila, good morning, welcome to NTV.
Thank you very much.
Give us an update on the vaccination distribution.
Yeah. We started vaccination distribution over the weekend, and as we speak now, as of yesterday evening, we had distributed 117,520 doses to 135 districts of Uganda. And the confirmed deliveries we had were 94 districts, and those were about 93,360 doses.
Yeah. Which area has the highest demand according to the Ministry of Health distribution?
Yeah, so according to our distribution, that would be Kampala, because Kampala is going to get 57,480 doses, and that distribution is going to be done today to KCCA, because KCCA is the one that sort of superintends over Kampala in terms of health. So it definitely has to be Kampala, and you have to remember that our distribution was based on the demand for second dose. So you find that a lot of people in Kampala had taken their jabs and were ready for the second dose. Well,
if you can just paint for us a picture across the country, when do you think the distribution will be done, and perhaps we see the Ministry of Health starting on the exercise of vaccination?
Right. Our target is to conclude deliveries by today, which is Friday, but also we recognize that we have to put some allowances. So give and take, completion of the entire exercise, perhaps Saturday, but our target is to conclude today.
Yeah. We have seen at a certain point people being in possession of the AstraZeneca vaccine. Not only that, many other vaccines. We also ask where there are gaps. Is it through your distribution chain that people are able to hijack the medicine, or after you distribute?
I think what people need to understand is that the National Medical Stores mandate is to buy, to store, and to distribute. And we have not seen anywhere any cases of interception of drugs along the way in the distribution process. Usually it's at the facilities or at the district level. So it cannot be during the time when National Medical Stores is distributing.
But Sheila, if I cut you short, we know that you have a newly introduced system, the online system of monitoring.
Yeah.
Are you not working hand in hand with the Ministry of Health in monitoring this vaccine?
That's what exactly I wanted to tell you, that when medicine is delivered to hospitals, the leadership of the hospital, the local leaders, members of parliament are notified that National Medical Stores has made deliveries to the health facilities. So then the tracking starts, and that's where we support the health monitoring unit, police, and CID, for instance, to ensure that the medicine that we have delivered at the different facilities, and this is not just medicines but also vaccines, are adequately utilized. And particularly for AstraZeneca, I've been speaking to my colleague Emmanuel Ainebiona, and he tells me this time round there have been more measures that have been put in place to ensure that there's no leakage or stealing of the vaccines. So we have UPDF coming on board to support KCCA in vaccination, which starts on Monday, as has been communicated by the Ministry of Health. So we hope that, and there's also going to be improved accountability in terms of when they start the vaccination and when they end. So you stock take at the start and stock take at the end in the evening, which was not the case before. So we hope that all those measures are going to address the challenge that we saw where vaccines were sort of stolen, but also that's a matter still under investigation, which I would rather not get into.
Well, Sheila, thank you very much for talking to us this beautiful morning. Wow.
Thank you very much.
Sheila Nduhuchire is the Principal Public Relations Officer for National Medical Stores, just giving us an update of the vaccine distribution in the country. Apparently, she says by Saturday, the process shall have ended, and the Monday, the Ministry of Health in different areas that have been set will start the vaccination exercise. Well, Rame Busiku, this beautiful morning, I hand over back to you in the studio. A very good morning to you and our audience.
Well, thank you very much, my good brother Ivan Walanyolo. 2,789,869,000 vaccinations have been undertaken on roughly 7.6 billion people who roam this earth. 2,789,000,000, yes, 869,000 plus vaccinations have been undertaken out of the 7.6 billion people who roam this earth. Out of that number, 10% have received all their dosages and they are safe. And 22% have received at least one dosage of either Pfizer, BioNTech, Moderna, Johnson & Johnson, AstraZeneca, and any of the vaccines on the market, Sputnik 5, or even the Chinese vaccine. Here in Uganda, we've undertaken some 845,000 vaccinations. Yes, single dosages, and 45,000 people have received at least all their vaccinations. So Monday should be the day when we start to see people going for their second dosages, or even those who haven't received any. So good news for Uganda now that cases are rising exponentially. But this show, Morning at NTV, has also realized that our citizens are actually experimenting with natural remedies and they are overdosing on them. And we do have Harriet Nakacha to talk about the challenges or the limitations or the negative impact of such a strategy of overdosing on natural remedies. Let's talk about that, Harriet. What are the complications that could arise from someone overdosing on natural remedies? You'd think that, no, this is aloe vera. I could take a whole bottle. I could take a whole jerrycan. So what are the harmful complications that could arise from that?
Yeah, with the natural remedies, I could talk to the public that, please, this overheating is a problem. Let's try to control also the dosage. Other people, once it's like honey helps to make the throat very clear, and they cough when it's just at the first stages. So people can just take honey anytime you feel like linking, talking to people, do anything. So please, let's try to control. Like even some people, when they are saying that you take lemon can be taken in hot water. You first boil the water, then you can add your lemon, Just a few minutes, like
Not
3.
putting the lemon in the water and then you boil for 20 minutes.
Somebody can boil 20 minutes to find the water boiling, the lemon is boiling. That is also killing the nutrients. Otherwise,
yes.
you will not take the right thing. Other people do the steaming. With this steaming, I don't know. Like a Katanga, like in Nakula, we have those the Chiunya areas, those ends. So you can find somebody steaming over 30 minutes, 1 hour's time, somebody is steaming. But if inside when they are steaming,
yes.
what you've seen is like they put this calico thing in jagger. So you could find somebody just dangling and say, what's this? We always talk to them.
So people are overdosing on these natural remedies.
People are overdosing. Yet the right procedure would have been you take the hot tea, you take the lemon, you can take ginger, you can take honey, you can take, what do you call this, tamarind?
Yeah. Turmeric. And you
so people, like, you can get vitamin
yes.
C, vitamin D, you can just do the sunbathing. Naturally, if you have low funds, you can take even the sunbathing. That's already vitamin D, so like in the morning and evening.
What's the quickest sign that you could look at and be like, okay, this person has COVID-19, or myself, I do have COVID-19. You have so many of the patients first complaining about some kind of pain within the neck area. Someone will complain and say, my neck is paining. I can't actually, swallow anything. Is that the first sign of acquiring COVID-19?
Really, it's among the first signs and the first symptoms. You feel like you want to cough, something's itching you, you want to throw out. Yeah. So I advise. And
at some point you lose your sense of taste and smell?
Yeah, that's it.
Yes.
That's it. You lose the sense of taste and smell. But then...
So at this moment, what kind of drugs do you give these patients when they come with these signs and symptoms? What kind of medication do you give them?
We can give like azithromycin, it's an antibiotic.
Azithromycin? Okay.
We can give like the Dexa. We can give like the...
Dexamethasone?
Yes.
All right.
Then you can get also the zinc sulfate because it boosts your immunity.
Indeed.
Yeah. Such things. Don't take overdoses or these other doses which are high. It's costly for nothing, actually.
Go ahead.
Yeah.
Go ahead.
Okay. Then also I can advise with the kids, let them do more exercises. With them, they can be so free with exercises. Not like with the old ones. We always dodge them even. But then it's not proper. Then with this throat, I think what you can do, like the first aid, let's always get the signs and symptoms of the throat first being treated or cared for. Because if it goes just below the throat, you will not manage. That will need the oxygen, the whatever, the admission and all that much. Yeah.
So moving forward, what challenges as Angel Medical Center have you encountered along this journey in this fight against COVID-19? Let's talk about the challenges you've encountered along the way. What is making your job hard?
Yes, some challenges are there. Like talking to the public, it's not easy. Then the costs, they always say, the costs are high, private sectors, the costs are high, they are just getting more money from the pandemic or whatever. But please, let's work together. Even the forces, I think. Policemen, please, and other soldiers, please, let's take note. Let's try to control also. Just talk to people, listen, let's try to listen. Because if we listen to each other, then we can overcome the problem.
All right, Harriet Nakacha, before I let you go, let's bring in the input of the government. What do you need government to do for you as private health practitioners to help you do your jobs better?
That's good.
What do you need from government? From
the government, I think I can say, let the government also work with us together, the public sector and the private sector. Let's work together. And then the challenge you have there, it's the treatment, medicine. I think some time to come, we can run short of some drugs. Because people buy even and they stock in their own houses. They do self-medication. Others just Google and then they get the thing. So let's try also to get the medication from the government. Let's the government help us. Please.
Harriet Nakacha, a private public practitioner, thank you very much for actually making the time to speak to Morning at NTV. Regards to Angel Medical Care Facility. And you're still watching Morning at NTV. Cases are rising exponentially within this jurisdiction. We are talking about 75,537 cases actually being registered in Uganda here. Out of those, we also do know that 781 people have died. 50,350 people have actually recovered from the novel coronavirus disease. 24,000 active cases have actually been registered. So meaning some of these individuals are not in the health centers. They are grappling within the communities. It could be your neighbor. It could be the chapati guy. It could be the border rider. It could be your wife. It could be your sister or brother. This is an invisible killer. You cannot see it. So on the international scene, we've noticed another uptick. 179 million and some 932,000 plus cases of COVID-19 plus have been registered on the global stage. The US is taking the biggest chunk of those cases with over 33.6 million. You have India with 30.1 million. You have Brazil with 18.2 million. You do have France with 5.7 million. You do have Turkey 5.3 million. Russia 5.3 million. You do have the United Kingdom with 4.6 million. Argentina 4.3 million. Spain 4.2 million plus cases of COVID-19. You do have Spain at 3 points. You do have Colombia at 4,060,000 cases of COVID-19, and then you do have Spain at 3.7 million, Germany 3.7 million. You can really see an uptick in the cases of COVID-19 being registered on the global stage. Our South African brothers and sisters are grappling all the same. 1.8 million plus cases of COVID-19 have been registered within that jurisdiction. Our Kenyan brothers and sisters are grappling with 181,000 plus cases of COVID-19. If you go to Sudan, the number is around 36,500. If you go to another country, DRC, 38,900 cases have been registered. Rwanda here, 31,000. Not even 31,000, they increased. 34,143 cases have been registered in Rwanda here. Weddings and other traditional meetings were also cancelled. If you go to Sassou Nguesso's country, Congo, some 12,000 plus cases of COVID-19 have been registered. The Horn of Africa, Somalia, 14,000 plus cases of COVID-19. Central African Republic, 7,100. Egypt, 278,000. Ethiopia, 275,000. If you look at another country right there, which one have I forgotten? Jamaica, 49,000 plus cases of COVID-19. And that's it for this conversation and the show itself. We shall leave you with some feel-good music coming in from Jamaica, reggae, to wrap up this show.